this computer is we are going to be recording this so that we can later on publish those for those who have not been able to view the discussion from Dr. Amy and Executive Director Kiana Beaudin. So we're really excited here today. You know, if we have any technical difficulties, that's on me, my apologies. But I think we're set up pretty well here. So please utilize the chat. And if we have any questions that we don't have any answers to, we are certainly known for getting right back to you on that. So at this time, I want to turn it over to Executive Director Kiana Beaudin and Dr. Amy. So thank you very much for joining us.
Good afternoon, everyone. As John said, I'm Kiana Beaudin. I am the Executive Director of Health. I'm also the Incident Commander and Health Officer for COVID-19 response. I am also currently on quarantine. I received a notice on my phone the other night that I was exposed to someone who tested positive for COVID-19. So I'd like to put a plug in for the exposure notifications that you can get on your phone. And then I'll let Amy introduce herself as well.
Good afternoon, everyone. Thanks for spending your time with us this afternoon. And as you may already know, I'm a family doc at the House of Wellness and doing our second town hall to talk about the vaccine and answer as many of your questions as possible. So it's an honor to be here, and I hope we can dispel any myths and answer your questions and concerns.
Okay, so we have a few talking points provided to us. I think actually what I'm going to do is I'm going to start with where we are at right now within the Ho-Chunk Nation. So we have 688 total positive cases, 40 active cases currently. This has jumped significantly since Monday when it was 16. We have 4,260 negative tests, 50 people that have ever been hospitalized, 11 people deceased, and no confirmed reinfections. I'm going to share my screen, and I just want to point out here that if you look, this is our hospitalizations by months, and we've really seen a significant spike since November. And in November, we had a significant spike in our active cases. And at one point, we had 99 active cases. So then next, we see our deaths. And our deaths have also started to increase since November. So a lot of our exposures are coming from community gatherings. So we've had to put out 13 exposure notices for community gatherings. And this is just for the gatherings that we were unable to contact all of the individuals that were present and could have been exposed. So this doesn't count the smaller community gatherings where exposures have happened. So I'm really asking each and every one of you to not attend community gatherings or mass gatherings. And mass gatherings are currently defined as 10 people or more, because this is where we're having most of our exposures and where most of our positive cases are coming from. So if it's not essential for you to be at these gatherings, please do not attend them. Also, our percent positivity rate, which means the percent of people who have tested positive that we have tested, is 19%, which is very high. However, this has come down from critically high, so we are improving a little bit, but still it's really high and not good. we want to be more around 5%. So we have received the Moderna vaccine, and to date, we have received 1,300 doses, and we have distributed 352 vaccines with no vaccine being wasted. So we were able to squeeze out a few extra doses from some of the bottles. And we are administering the vaccines through what we call a pod, or point of dispensing. And each of those locations are at the House of Wellness in Baraboo, Wisconsin, and the other is at the District 1 Community Center in Black River Falls, Wisconsin. And we have tiers. You've probably seen that graphic go out. And the first tier was healthcare personnel. And then after that, we had elite elders and eminent speakers. And then this next pod will be elders 60 and over and frontline essential workers. And the way we have determined these tiers were through the guidance from the Advisory Committee on Immunization Practices, along with the CDC. And we have a group of health department employees, also composed of about half Ho-Chunk Nation enrolled members who had quite a bit of input. And we also conferred with other departments within the nation and got approval from the president. So that's how we came up with these tiers. And I'd like to say that we've had really positive feedback regarding our events. Everything is set up so that it's socially distanced, and everybody has felt very safe, and it has run very smoothly. So that has been with our smaller events. This coming week, we will have a larger event. So I'm looking forward to see how that goes as well. We do have a pre-registration for the events, and that's a link that has been sent out. Also, you are able to call and pre-register, and this has been sent out on the flyers. Just so you're aware, you do not have to pre-register. You can register at the time of the event and you can just show up. It will just take approximately 5 minutes longer for you to get through the process than if you did pre-register. So Amy and I had the privilege of being some of the first individuals who were vaccinated through the Department of Health. We've had one dose. Moderna is a 2-dose series, and you need to receive the vaccines 28 days apart. So I myself only experienced some mild arm pain, or also known as pain at the injection site. I did feel a little bit of fatigued, but I could not determine whether that was just my kind of normal level of fatigue or if it was due to the vaccine. I have had some people report to me that they've been really super tired and kind of wiped out after the vaccine for about 2 to 3 days. I believe that the normal range is about 3 days to experience side effects. And Moderna, I believe they said it was about 30% of individuals experienced some kind of side effects, but they weren't necessarily severe. Amy, do you want to talk about your experience?
Sure. So, like Yana said, we were among the first to receive the vaccine rollout. I too experienced arm soreness at the injection site. Mine lasted a couple more days, and instead of describing it as mild, I would describe it as moderate. Hurt to lay on it, like that night at the night of the day that I received it, but gone by day 2, and definitely got better as time went on. I also, I'm not going to say this was a privilege, but I also had the experience of having COVID-19 back in November. And that was 8 days of my life that I'll never get back. Very marked by fatigue and body aches and a very weird, I don't know, different sort of cough. So, and I know other people have experienced very mild symptoms to sometimes even no symptoms. And then those, unfortunately, who have passed away from COVID-19. So there's really no predicting how you yourself are going to be affected if you were to become infected with COVID-19. So I think that's one of the other, if I had to choose between arm soreness for a couple of days and the 8 days that I had of body aches and fatigue, I would definitely choose the vaccine. So that's it.
Okay. And then you may have heard in the news that there have been some additional new strains of COVID that have been found. And I'd like to reassure everyone that at this time, it appears that the current vaccine is effective against these new strains of COVID. So it is still recommended that you still get the vaccine. And one of the new strains has been detected here in Wisconsin. So it's already here.
Okay, I'm going to go next on the list of questions we have. So just some facts about the vaccine. One of the things we covered at the last town hall was that the vaccine for COVID-19 is a killed vaccine. There is nothing live about it. So you will not contract COVID-19 from the vaccine. So I just want to make that clear. The second question is another topic that we covered last time as well. Is it better to get the vaccine or get the disease? And like based on my own personal experience as well, but the research has supported that it's better to get the vaccine than the disease. And the reason for that is just like I had stated, we don't know the type of reaction any one person is going to have. Anything ranging from mild respiratory illness, cold symptoms, to death. So because of that, it's much safer and wiser to get the vaccine. The next question is, if you get the vaccine, can you go back to do whatever you want? Yes and no. You can go back to work, you can cook at home for your family, but you do have to wear masks still. You do have to avoid social gatherings of 10 or more people, and you do have to remain social distancing. So I do want to make that a very important point because the vaccine likely won't be rolled out to the general public until this spring or summer. Really, in the short term, the most important way to prevent the spread of COVID-19 for most of us is going to be wearing a mask when you're in public and social distancing and avoiding the gatherings. So, and if you're eligible to receive the vaccine, please get it. So I'm going to add that, to our toolkit in ways to prevent the transmission of this disease.
And I'd also like
you
to
get the next one.
Remind people that the proper way to wear your mask is over your nose and under your chin. Your nose is kind of the reservoir for, or where the most concentrated area of bacteria or virus is. So if you're not covering your nose, you're really not doing a very good job of protecting others. Okay, so the next question is, when can we expect to get more vaccine? Unfortunately, we don't have a really reliable answer to this question. We are ordering vaccine every week, and we have been receiving varying numbers of vaccine. So hopefully we continue to get vaccine every week, but we don't know how many that will be. Our last vaccine dose amount was 60 vaccines at each site. So that would be a total of 120 vaccines that we received. And how will the community know more about the vaccine being available to them? So we've been working with our social media platforms, with our legislators in order to get the word out at area meetings, with the WODOC. Word of mouth seems to be best. And then again, if you have any other suggestions, please let us know. And we do have a dashboard set up on our Ho-Chunk Nation Department of Health website. I'm going to share that right now. So this currently lets you know about our confirmed cases, fatalities, our negative tests, all that good stuff. And eventually we will be adding our vaccination information as well. That is currently in the works. Whoops. Okay. So it's like we'll move on to the questions that were submitted prior to the event. Is it true that vaccine alters your DNA? I believe Amy answered this already.
So this, I just want to add that this vaccine that we have is called an mRNA or messenger RNA sort of vaccine. Again, it is not a live vaccine or attenuated or weakened version of COVID-19. It is an mRNA vaccine. It does not alter your DNA at all.
The best way that I've heard this described is like it's an email. So you download the attachment for the instructions to make the protein in order for your body to be able to fight COVID-19. And for you gamers out there, it could be a game that you're downloading to the game console. And the vaccine does provide better protection against the virus over natural immunity. It has a more reliable level of protection versus natural immunity. At this time, we do not know how long immunity lasts from the immunization because it's so new. So as far as I know, they're planning to track all of the individuals who participated in the trials for 2 years. If I already had COVID-19 and recovered, do I still need to get vaccinated and why? Okay, that was the same answer there. What is the process in determining a vaccine is safe? Do you want to take that one, Amy?
Sure. So this is answered by doing what we call clinical safety trials. Each company who now has the vaccine out, Pfizer and Moderna, conducted studies, each one of them say on 15,000 people. So a total of at least 30,000 people where the safety of this vaccine was tested. That's how the process is determined if this vaccine is safe. And as we continue, as we learn more about the vaccine and track any sort of adverse side effects, we will learn more and more about this vaccine. We have been advocating for those in our population who get the vaccine to enroll in a program called V as in Victor, SAFE, to basically track any sort of side effects that anyone develops.
Are other household members able to get vaccinated along with tribal members and employees? So at this point in time, I'm assuming that this question is if they're not within the tiers. At this point in time, we're not doing household members. That will come at a later point in time, but we will be doing household members. When can kids with health concerns get the vaccine? So currently, Moderna is approved for 18 years and older, and Pfizer is approved for 16 years and older. They're in the middle of trying to recruit and do more trials for younger individuals. So we're hoping that we'll see that approval come for at least adolescents in the near future. Governor Evers said people over 65 can start getting vaccinations on Monday, January 25th. Is there a reason why we have to wait until Tuesday and Thursday? So the reason why we have to wait is because that's when we have already scheduled our pods or vaccine events. And it takes an immense amount of planning and an immense amount of personnel to facilitate the pods. So we already had them set up, and that's why we're waiting until that point in time. If you are Ho-Chunk and your kids are not enrolled, will they be eligible to get the vaccine? If your children still live with you within your household, they will be eligible once we get to the household members. Amy, would you like to explain the timeline of immunity?
Yes. So when you receive the vaccine, it takes about 2 weeks for your body to mount a response and to actually use the antibodies to protect you from getting the infection. So that's typically what I counsel my patients, is that you can expect 2 weeks before your body is immune or has the antibodies to protect you from COVID-19. Um, and again, I think we stated this at the last town hall. If you were to get sick with COVID-19 a day or two after you receive the vaccine, that simply means you are exposed, either in the day two, prior to getting that vaccine, and then developed it. Again, it takes 2 weeks approximately for your body to mount a response. Um, and then you get the booster, like Kiana mentioned, 28 days later. And then that would be considered full protection. So until you get number 2 vaccine, you don't have the full antibody response. So the other thing I want to add to that is we talked about side effects from that first vaccination. You also have more what we call systemic side effects with the second one. And that, like more headaches, fevers, um, body aches, that sort of thing from that number 2. This is what they're predicting. We'll know, I'll know more after I get number 2 next week. But again, the side effects after dose number 2 tend to be more systemic, like body aches and headaches.
The next question is, can you receive the vaccine if someone in the same household is on quarantine? So the answer is yes, you can receive the vaccine if someone in your household is on quarantine. You yourself are not on quarantine. So that is the answer to that one. Amy, when someone gets the booster shot, when is it okay to visit them again?
Well, if this is someone you live with, you can continue to live with them. If this is somebody who does not live with you, remember the time frame is typically about 2 weeks. So I would say give it, about 2 weeks before you visit them.
But you should still do so safely, wearing your mask, staying 6 feet apart, washing
Absolutely.
your hands.
Thank you. Absolutely.
Oh, and I also have to clarify my question about the children in the home. Again, Moderna is only approved for 18 and older, and Pfizer is approved for 16 and over, and we have received the Moderna vaccine. So after getting the booster shot, how long does the vaccination work? We don't know the answer to that question yet. when do you think things will go back to the new normal? I think that's a loaded question. I think it really also depends on how many people get the vaccine, if people stop going to mass gatherings, how many people continue to wear their masks. Do you have anything else, Amy?
I agree. It's a loaded question. And I believe that if there's a crisis, like we have with this pandemic, things really never go back to the way they used to be because of all the things we've learned and how we've adapted. For example, as a family practice physician, I likely will continue to do some telehealth visits for the remainder of my career. And that's something that started with this pandemic. So I and even my colleagues will likely continue to carry out this service, especially for those who live far away in a different state and it's very difficult for them to get to the clinic. Um, so that's just one example of how um, my job will forever be transformed, and I think for the better. So one of the good things I think that's come of this pandemic is more telehealth services for those who live far away, or even for those who live close but don't have transportation.
Mhm. When someone gets the vaccination, will it be on their immunization record? Yes, it will be on your record. And for those of you who live in Wisconsin, we have an immunization registry and it will be entered in there as well. We live in the Chicago metro area. Will you be working with the Indian Health Center there to vaccinate Ho-Chunks living in the area, or will we need to travel north to receive the vaccine? I believe you can access the vaccine through the Indian Health Center there. And I do have a link for other Indian Health Service locations for the rest of you who do not live in that same area. So I am posting it now. So it's ihs.gov/findhealthcare/. So this allows you to, I'm actually going to share my screen. This is what you'll see, and it allows you to put in your address and choose what kind of healthcare you're looking for. So for all of our D4 members, you can use this. Actually, you don't even need to limit yourself to D4. You can use this to find healthcare from IHS. Also, we have Vaccine Finder, which is vaccinefinder.org, and you can use that. However, it's not active yet for COVID-19 vaccines. It will be active once the vaccine becomes more widely available. And once again, we have the Moderna vaccine that we are currently administering. So those were all of the questions that were in to us before the event. So one question here in the chat is, when will the health department come to other Ho-Chunk Nation sites for immunizations? So once the vaccine becomes more widely available, we will be looking to start going into the other communities. But at this point in time, we have such a small amount of vaccine that we will only be doing the pods at the District 1 Community Center and at House of Wellness. Why do elders have to drive over 3 hours one way to get immunized in January? Again, that's just because we don't have enough vaccine to give to wide numbers of people. And our best bet is to do it at our 2 sites. When elders have been called, if they need assistance with transportation, we are trying to provide that, but we have a very limited number of available transports. So if you need help with transportation, please indicate that when you call to register. Should people who have tested positive get vaccinated? And if so, is there a waiting period from the positive test? Do you want to take that one, Amy?
Sure. It's a great question. And yes, people who have tested positive, there typically is a waiting period. So if your infection was less than 4 weeks ago, and I'm kind of making that up, that you should probably wait because your immune system is still somewhat activated. So it might even shorten it. So if you had the infection just 2 weeks ago, I would wait at least another 2 weeks. I'm going to give an example of my mother, who's in a special situation, but I think some of you out there who might be listening could relate with a family member who has cancer, primary cancer or metastatic cancer, and their white blood cell counts are being monitored and or they're on chemotherapy. So she too had COVID-19 and was advised to wait as a almost 71-year-old person with cancer and with a low white cell count to wait 9 weeks before she got the vaccine. So it is very different for each person, depending on their age, depending on their medical conditions. And if there's ever a doubt about the time that you should wait before getting your vaccine, please consult your primary care person or one of our nurses so that those factors can be included in giving you that information.
Thank you. The next question is, are you holding our secondary shot in reserve for us? Yes, we are. So if you received your first shot, you will have a second shot that we will hold for you. And by that, I mean that when you are scheduled to receive your second dose at the event, there will be enough vaccine for the individuals who are requiring their second dose. And also the doses arrive in a vial that contains 10 doses. So we cannot give you the vaccine at your clinic appointment just because when we open up the vial, it needs to be used within 6 hours. So if we don't have enough people to give that vaccine to, then all of those other doses will go to waste. So that's also a limiting factor for us. If I currently have antibodies, can I still get the vaccine? I had COVID November 16th through 28th. Yes, you can still get the vaccine. And if I get the vaccine, can I still donate plasma? I think that's a great question. I don't know the answer to that. I would ask the plasma center.
I concur.
Okay. What are the tiers for the vaccine? So the tiers are 1A healthcare personnel, 1B is elite elders, eminent speakers, frontline essential workers, 1C is elders 60 and over, and essential workers. And then we move on to, oh, and also included in 1C is individuals with high risk conditions. So we do have a list of the high-risk conditions, and there's fairly common actually. So it's high blood pressure, obesity, diabetes. We do have our document up on our website. So if you want to know the whole list, there's a link there. And maybe Pam can also put that in the chat. And then after that, we would move on to tribal members and family members. How can we quell the fear and anxiety of taking the vaccine? Education, TAU programs involved. Amy, do you want to start out on this one?
Sure. And as a primary care physician, I have been getting phone calls and even text messages from some folks just, what do you think about me getting the vaccine? Just a lot of hesitancy, which I think is normal because the vaccine is new. COVID-19 is new to us. And we don't know everything at this point in time. So what I've been advising people is we know that it's safe and we know that it works. And we know that it's better than getting the natural infection or getting COVID-19. So I do recommend it to people. And again, like I said before, if there's any question about you, yourself, and your health condition, please talk to your primary care person. But I think that the single most important way is to gather that, to look at the information and read it and make an informed decision. And then talk to people in your family and your community. One of a piece of advice that I just gave yesterday was if you're afraid of getting the vaccine, think about getting the vaccine for your grandmother or grandfather, for your, or if you're older, for your grandchildren or your great-grandchildren. This is something that, in addition to protecting you from COVID-19, also protects our family members and our community members. So it's very similar to the flu and the advice I give with that. That if you yourself aren't a big fan of getting the flu vaccine, do it for the older or younger people you live with, and for your community members.
I'd also like to point out that there were no shortcuts taken with the vaccine trials. Generally, what happens is that all the processes happen in sequence. So they do the trials and then they manufacture the vaccine and then they push it out. However, with this particular vaccine, everything happened at the same time. So while the trials were happening, the vaccine was being manufactured, which is why it seems like we have it so quickly. Another thing is that the mRNA vaccine doesn't need to go through quite as many steps as the traditional vaccine does. So that's also another way that it was available more quickly and at a cheaper cost. Speaking of cost, Ho-Chunk Nation is not charging for the vaccine, so it will be free to whomever receives their vaccine through us. If you go to another site, there may be an administration fee that would be charged to either yourself or your insurance. Okay. What is the risk of getting the vaccine if you have a food allergy?
And I actually looked at the ingredients of the Moderna vaccine, the one that we're giving, and there are no eggs in it, anything like that. So it's really, if you develop, and this is, it's a new vaccine. So if you develop a severe reaction to the first one, then you obviously don't get the second one. But if you have an egg allergy, it's perfectly safe to get the Moderna COVID-19 vaccine.
Mhm. And so what we're doing to safeguard for people who do have allergies in general is we will be watching you for an extended period of time. So the normal observation time is 15 minutes. For those of you who have allergies to vaccine components or have had an anaphylactic allergic reaction in the past, we will be watching you for 30 minutes. We have healthcare staff on site. We also have the appropriate medications that we would need to administer if somebody would have a severe reaction. Can tribal members who are essential workers outside the nation be vaccinated when the nation's essential workers are vaccinated? Would they need to provide documentation of being an essential worker? Yes, they would need to provide documentation. And yes, we would allow you to come to the site. So if you could contact the registration folks and let them know that you are an essential worker so that they can also let the vaccine team know. Another point is that there are restrictions on transporting the vaccine because it's coming from the federal government. So that's another barrier to us hosting events at our outlying communities. We have to put in an application and receive approval for hosting events on other sites. And that's all we have for our questions. So if you have other questions, please enter them into the chat or scan that little QR code on your phone and you can submit your questions. Do you have anything else you'd like to say, Amy?
I think the only other thing that I would say, and this is based on some of the questions I'm getting from community members, is again, hesitancy. I don't want to do this because I think there's someone more high risk than me, and they need to get it more than I do. Or even I had guilt because I had COVID-19 and I knew I had some immunity. And why shouldn't somebody like my mother get it before me? So I just want to assure everybody that if you are eligible to get the vaccine, to do it, because of all of the barriers that Kiana has described with the limited supply of this vaccine and how it's distributed, how it has to be stored in certain, frigid temperatures, and how it, the lifespan of it is 6 hours. All these things are process issues, and not about picking and choosing who we give the vaccine to. So again, if you have the opportunity, you're eligible for the vaccine, it is important to get it and not feel guilty. I feel like there's all these other factors involved. So
I'd also like to reiterate the importance of staying home when you are on quarantine or especially isolation. Um, Especially for those people who are on isolation. I know 10 days is a long time. 2 weeks can be a long time for those who are on quarantine, as I am myself. I am feeling great. I have no symptoms. But this is the major way that we limit the spread of COVID-19. There have been instances of, one person shutting down an entire operation because they were bored and wanted to come out of isolation and went visiting, so this is a very real issue and something that impacts people's workplaces and homes and communities. So I'd also like to encourage each of you to get the vaccine when it becomes available to you, because each of you are important. Each of you have a role and a place in your family, community, and within the Ho-Chunk Nation, and we need you. I see that we have a couple more questions. So I've heard of there being doses not used because folks miss their appointment times. Not sure if that's true, so I didn't want to put it on the main chat. Whoops, that was supposed to be to me privately. So the answer is that we have not had any wasted doses. We have actually been able to pull a few extra doses from our vials. And we do have a standby list that's been created. The executive directors have been requested that they get the contact information from individuals from the following tiers so that we can call them if we're having a low turnout, which has happened in the past few events. So we have called people from the following tiers and in the surrounding areas to receive the vaccine because we didn't want to waste any. So thank you for that question, even though it was supposed to be private. And how safe is it to visit a relative or friend if both got the vaccine and the booster shot? So what we do not know at this point is if the vaccine reduces transmission. So you should still continue to wear your mask, stand 6 feet or more apart from one another, wash your hands, all of those good things. So at this point, Ho-Chunk Nation Department of Health is not recommending any changes and any policies for workplaces or anything along those lines until we know whether or not the vaccine reduces transmission. It's a great question. All right.
There's one right above it, Kiana. After receiving the second dose, how long does it take to become immune?
Oh,
And again, approximately 2 weeks.
so in total, we're probably looking at almost 6 weeks from your first vaccine for you to have immunity at the level of, I believe it's 95% that they're saying for both Moderna and Pfizer. I also want to reiterate that the vaccine is not intended to prevent the illness. It's preventing the severe side effects, which would require an individual to receive hospitalization, or unfortunately, maybe they would pass away. So what we are trying to prevent is those two things. Any other questions, privately or publicly? All right. Well, if there's no more questions, I think we can sign off and thank you everyone for attending and all of your excellent questions. And we will continue to plan and host these events.
Do you want to say something?
So, Egishige, Hanach, Hinikadagiwi, Deg Hijakoro, Jagu Hishere, Wine up, PSK, Hanakonigi PSK. Hoke Wahide, Ide Shunu, they ho chunker Jagu, Wochehinag, Ostoide Shunu, SK Hante, Kedu Huduganawi, SK Hante, Nach, Hidakadagichawi. This, you know, I was told that our Ho-Chunk people, whenever there was anything difficult that they confronted, they would come together, and we gathered. That's what we did. That's how we found our strength, and today we can't do that. And I know that our leaders in health have a job and have a objective to make sure that whatever it is we can do by advising to social distance, wash your hands, get the vaccination if you can, you know, everything that they can do to reduce the spread of that will help us all in the end. But, you know, I think we have to take that as a community one step further. Now, I do work for health, and I do promote all the important things that they do to help our communities. I'm also a tribal member and a Deer Clan member and a messenger. So I do try to make sure that what it is that is said gets out there to where it needs to be. And in their professional roles, they speak very politely and eloquently. But in reality, we have to be a lot more firm about this in our homes, in our communities where we work. In a sense, we need to take the kid gloves off. We have a lot of influence out there saying the vaccine is going to get you sick, or this is fake, or this isn't happening. Well, I'm out there in the community and we're burying people every single day because of either this illness or something related to it. And in our homes, that's the first place we start, making sure that we are social distancing, keeping our hands clean, trying not to gather. And as much as you want to hug your loved ones, the more you love them, the more you shouldn't. That's the most difficult part of this whole thing. But it's what's going to keep us alive. We have a solution on the horizon. We need to encourage folks when available to get the vaccine. We also need to encourage those same folks to go back home, and stay isolated until we can get it under control. It's difficult to do, but we'll find some pleasure in looking at the healthy horizon that's ahead. So I want to thank Dr. Amy, Ms. Kiana, and certainly, this system wasn't made to have one person fix it. It was made to have everybody do a little bit of something. So right down from our health leadership to the people that are picking up those garbage bags in our offices every other day. Every part matters. So I just want to say thank you guys for tuning in. We're going to do this as much as needed, making sure we have a direct connection out there. I know our team doesn't like to simply speak through Facebook posts and media and bulletins and alerts. They want to speak directly to you. This is the best way we can right now. So I want to say thank you guys for reaching out. This isn't anyone pushing other than our leadership wanting to make sure that our communities are getting the direct responses that they need. So I want to say thank you to them. Thank you to each of you for tuning in. I am recording this, so I will be posting that. It might seem a little dry toast for some folks, but this is what's changing the world, and the new normal is we're probably living in it right now. So take care. So we're going to tune out. So thank you very much for all your attention and for caring enough about not only yourselves, but your family and people around you. Talk to you later.